A very good evening to all the parents. Thank you for coming online and giving your time and patience for this talk. I, Dr. Vivek Jogani, I'm a pediatric and preventive dentist from Mumbai. And in association with BabyChakra, I'm going to take today's topic, dental trauma in children. This topic is very commonly neglected both at school level and most common at physical training levels. So let us understand about the dental trauma in children. By the end of this sessions, we'll have a couple of question answers. So be ready with your question answers and we can have one-on-one discussion as well. Yeah. So before going on to the topic, let's discuss about the teeth in children. Usually kids have two sets of dentation. One is the primary teeth and one is the permanent teeth. So when I say the primary teeth, it means the milk teeth. And when I say the permanent, it means the secondary set of teeth which nature has given after the primary teeth or the milk teeth fall down. So how many primary and how many milk teeth do kids have? Usually kids have 20 milk teeth and 32 permanent teeth. Now, when we have to discuss about the 20 milk teeth, these are the incisors, the two canines, and the two molars, one on each side. That makes it 20 milk teeth. And when we talk about the permanent dentition, we have the same four incisors in the permanent set of teeth, followed by two canines and two molars on each side, both up and down, right and left. So 28 plus 4 are nothing but the four wisdom teeth, which very commonly are unseen in kids these days. The functions of the teeth, before going into trauma, let's understand what is the function of the tooth, which is equally important. So when we say the functions, the front teeth, also known as the incisors, they are nothing but for biting purposes. The canines, they are for tearing the food, and the molars and the premolars are for chewing and mastication of the food. So, having known the two sets of teeth, the primary teeth and the permanent teeth, what we need to understand is when do the milk teeth get replaced with permanent? Well, they don't get replaced overnight. It happens over a period of time. So, let's say, for example, it starts at around 6 years of age for until 12 years of age. So the milk teeth start coming by 6 months and the entire 20 teeth are completed by 2.5 years, plus minus 6 months for each individual. And the permanent teeth start coming, that is the incisors, the front teeth, they get exchanged at 7 to 9 years. And the molars, that is the premolars and the molars, they erupt at 10 to 13 years of age. Yeah. Okay, when I talk about trauma, we need to understand what is dental trauma. Any kind of injury that causes a laceration or bleeding in technical terms, or any kind of injury to the face or the teeth, including the lips and the gums, is known as dental trauma. So when we talk about kids, dental trauma keep happening very often. It may happen on an infant or a young individual. So how do we take care of them at home care level? This is what we're going to cover in today's topic. The causes of trauma. There are a variety of causes for trauma to happen. Most common cause is fall. A fall can happen from a bicycle or for an infant and a toddler from the bed. Any fall can result in trauma, or any fall on the face can result in trauma to the face and the facial features. Other common reasons are accidents. It could be road traffic accident or while playing sports. Sports could be two types: contact sports, those are known as rugby or football, or boxing and wrestling, or it could be a non-contact sports in the form of cycling or running or relay or something like that. Also, nowadays, what we see many times, unexplained traumas are maybe because of child abuse and neglect, or it could be assaults that happen on the kids. So any kind of facial trauma can and should never be neglected. Well, apart from these, most of the individuals are more susceptible to trauma. मतलब अगर कोई गिर जाए, एक बच्चे को चोट भी नहीं आए, but दूसरे बच्चे को अचानक से चोट आ सकती है. Why does this happen? This happens more commonly because Many a times some kids could be thumb suckers, and because of thumb sucking their teeth flare out and bahar aa jate hain. Local language we call it फावड़े की जैसे दांत बाहर आ गए हैं. So when these teeth come out, it and there is an impact happening on the teeth, they are more susceptible, बहुत जल्दी उन दांतों में ट्रॉमा हो जाता है. अदर रीजन कुड बी दांत सही से लाइन में नहीं है, क्रॉस बाइट में है, या फिर जो बच्चे स्पेशल हेल्थ केयर नीड्स वाले बच्चे होते हैं जैसे कि एपिलेप्सी एंड सेरेब्रल palsy. In case of cerebral palsy, it is because of the spastic and the tight nature of the jaws, and many a times when kids have epilepsy, that is the time when trauma may happen. So there are two types of trauma can happen either to the hard tissues or the soft tissue. So anything that causes trauma to the cheekbones or the jaw bones, the teeth, it is known as hard tissue trauma. And anything that happens to the cheeks, the lips, the gums, the tongue, these are known as soft tissue trauma. Then it could be a direct impact trauma or an indirect impact trauma. A direct impact trauma is nothing but a trauma that usually happens, like for example, let's say a child is riding a cycle and he directly falls on the floor and has an injury. So this is a direct impact trauma. But if a child may fall, on a table, or a drawer gets struck to the lower jaw, and this impact causes impact on the upper jaw. So impact from the primary, where the forces are accepted, to the secondary level, these are known as indirect trauma. Most common trauma that we encounter in kids is aversion. Aversion is nothing but जब पूरा का पूरा दांत ऐसे हाथ में बाहर आ जाए. Can you see this? This is nothing but avulsion. इसको हम technical terms में avulsion कहते हैं. So let's, for purpose of ease, let's discuss this in detail, because this kind of trauma is commonly seen than many other traumas, and this is the trauma which should be managed at home care level. Most of the traumas that usually happen, you rush to the dentist or the nearest doctor, and depending on the need, X-rays are taken, checking is done, and then you can understand what type of trauma has happened. But when I talk about aversion, when I talk about the entire permanent tooth coming out in the hands and lying on the floor, this is more important, because this very commonly, it does not happen in adults. It happens in young individuals when the tooth has just started to come out. यानी कि जब तक उसकी जड़ फॉर्म नहीं हुई है, roots are not yet formed, that is the time when this kind of trauma happens. And this common age is 6 to 12 years of age. It can happen anytime. Well, this trauma can happen to a small baby also at any age. So let's go age wise. Let's start from a 1 year old or a 2, 3, 4 year old baby has fallen or has an accident, and the front teeth or any of the teeth are have come out and lying on the floor. What are you supposed to do? First, identify the age. If it's a milk tooth, you don't have to worry much. All you have to do is take the tooth along with the child to the nearest dentist. They take an X-ray and they evaluate the condition. Most of the times, no intervention is needed. The same tooth need not be replaced, because the permanent tooth is gonna come in coming few years. If the tooth has gone inside the gums, say by 2 to 4 millimeters, the dentist will advise you, depending upon the need, whether it has to be repositioned or it has to be just kept under observation. So your pediatric dentist is the best one who's going to take the complete call. Then you have, say, from 6 years to 12, 13 years of age, if a permanent tooth comes out in hand. Let's say a trauma has recently happened right now, maybe 2 minutes back, and the tooth is in my hands. What are you going to do? Well, the first thing is, being a parent, do not panic. Time is the gold standard over here. If you panic and waste your time in panic, you're not going to achieve anything. The first mantra is, do not panic. The second mantra is, do not waste time, and just go through the protocols that I'm going to explain you right now. You can also, record it, write it down. First of all, identify whether the child has had or is having any blackouts or any vomiting. If there is no blackouts and no vomiting, you have to assess the child's status with respect to time, place, and person, and then rush to the nearest pediatric dentist. If you rush to the pediatric dentist, if it is the best, if not, then I would at least suggest you to rush to your nearest dentist. Once you have reached, now how are you going to reach your dentist? You're going to take the tooth in your hands along with you? Absolutely no. You should not be taking the tooth in your hands, nor in a tissue paper, nor wrapped up in a newspaper. By doing this, you're going to make the tissues of the tooth dry and desiccate, and they're going to die. You have to keep the tooth alive. And how are you going to keep this tooth alive? The best media is something called as HBSS media. This is available at most of the chemists, but if you don't have time, you can just get access to mineral water or a cooled boiled water. And if either of them is not available, you can rush to the near, you can, get access to boiled milk at home. You would have milk which is boiled in the morning and refrigerated. Do not sit to boil the milk. Take the milk from the refrigerator, keep the tooth inside the milk, and you can rush to your nearest dentist. Many times, this kind of trauma happens at picnic spots, trips, school. Kids are taken for some field visit, and what are the teachers going to do over there when you have no milk, no mineral water, no chemist available? Someone would obviously be carrying something called as your contact lens solution. The pH of the contact lens solution is very balanced, so you can carry the tooth in the contact lens solution, or even honey, something called as propolis. So once you have identified the tooth, keep it in a moist media. I repeat, the best is the HBSS solution. Then you have mineral water or normal saline from the nearest chemist. You have boiled milk, which is cooled down, and then you have honey or your contact lens solution. Also, coconut water can be beneficial at times. So you have to take the tooth inside the any of this transport media, and you rush to the nearest dentist. The second most aspect, if nothing is available, identify if the child is old enough, conscious with respect to time, place, and person. The child is comfortable, not panicky. You can keep the tongue you can keep the tooth just below the tongue of the child, or collect a little bit of saliva in a bowl of with asking the child to spit if there's no excessive bleeding, and then you can rush the child and the tooth to the nearest dentist. Now, again, once now that is the transport media that we have discussed. More common that we have is, now if this tooth is on a field visit or in a school trip and it is soiled with a lot of dust and soil or sand or debris or whatever you're going to do is, you're never going to hold the tooth with the root. You're always supposed to hold the tooth with the crown portion, or that portion of the tooth which is visible in the oral cavity. Wash it under running tap water without touching the surface or scrubbing the surface. When you scrub or touch the surface, you're going to damage the tissues more, and then the body is not going to accept it. So just gently clean the surface by keeping it under running tap water, keep it in the storage media, and then you can rush to the nearest dentist. Again, if the child is old enough and very comfortable and very cooperative, you can gently place it in the socket also, and you can just mobilize the child to the nearest dentist. Now, once we have done this, you've reached the dentist. What are you expected to be doing? You have to give a complete history to your dentist, including your vaccination history for tetanus, what kind of injury it was. It was a clean injury or a soiled or an infected injury, because depending on the need, the dentist will have to advise antibiotics, analgesics, and tetanus in a TT injection as a booster if booster is not given on time. The golden period over here, as I discussed at the start of the lecture, was that the early you intervene and the early you visit your nearest dentist, the better and the best chances are that this tooth is going to be accepted by the body. So the golden time period is anywhere between 0 to 15 minutes, but well, practically it is not possible to visit a dentist in next 15 minutes until he's just staying next door to you. The next golden time period is 15 minutes to 60 minutes. And in this time frame, if you have taken the tooth without desiccating or drying the tooth, and in the media that I have explained right now, Trust me, your dentist has to do minimum job is just by taking a little bit of history. Then he has to take an X-ray to identify the socket, clean the surface, place the tooth back, and splint it. What do you mean by splinting? By splinting, it means that the dentist is just gonna wire the tooth for stabilization for another 2 weeks, post which once the stabilization healing has happened, the tooth is taken back by the body and the bone. Wire is removed, and well, the treatment is done, and the child is sorted for life. In case if the golden time period is not followed and you reach beyond 60 minutes, maybe 1.5 hours, 2 hours, things like that. So in those scenarios, it may happen that your dentist will have to splint it, but post splinting it, he may have to get a root canal done for the tooth. Well, it's a time tested procedure, but in any case, whatever your pediatric dentist suggests, go with it because they're going to suggest the best for you and for your child. And trust me, the early you intervene and early your pediatric dentist, takes a call, the tooth is going to be saved for life. If not, then the child remains without a tooth. And if the child remains without a tooth, yes, it can be replaced, but it can be replaced after a certain age. Implants cannot be done until the child has crossed 15 years of age. Because of the growth and development of the jawbones is still pending until the child is 15 years of age. So until 15 years of age, implant cannot be done. And in those scenarios, there are many other modalities and options. But well, first thing is again, I repeat, all you have to do is identify that the child is having no blackouts, no vomiting, and the child is conscious with respect to time, place, and person. Identify the tooth. Take the tooth gently with the crown portion, wash it in the running tap water if it is soiled or infected. If not, keep it in a transport media. Transport media is not your tissue paper or your newspaper. You're going to dry and desiccate the tooth if you keep it inside that. Your transport media is only and only the few medias that I enlisted, that includes boiled milk, saline, or mineral water, or for that matter, contact lens solution, or even coconut water. Rush it to the nearest dentist, give a complete history, let your dentist take a radiograph or an x-ray and fix the tooth and splint it, and if need be, root canal may be indicated. Now, that's only and only possible with young permanent tooth if you have taken in the golden time period. Now, what about the traumas that usually happen to the soft tissues? It could be a laceration on the tongue, on the lip, on the frenum, that is, the freni which is usually present on this portion, or it could be the gums, it could be the cheek muscles. So, depending on the site, it can be, identified. All you have to do is, more importantly, if there's any kind of soft tissue trauma, again visit your nearest dentist. And if there's any bleeding should be arrested by tight compression or a cold pack. And you should not allow lot of blood loss to happen during this time period. So, with this, I think we have covered the major aspect of aversion, that is trauma to the young permanent tooth. What happens if it comes down in the school or on the ground? You can also teach this, to your kids, that whenever you fall down and your tooth has popped out, first thing is identify the tooth and get it back to your parent or the nearest guardian available, and just take care of it. With this, I'll brief you a little more on this, but there are a lot of questions which have been coming of late. So let's first take few queries and let's answer each of them. Um, okay. So Divya Patil has a question that what age should a dentist see a child? Well, I would put the question the other way around. What age a child should see a dentist? Well, a child should see a dentist by his first birthday, and if not, then he should at least see once the tooth have started erupting. Can a tooth heal itself after trauma? Yes, a tooth can heal itself after trauma provided you have not damaged the tooth by scrubbing and rubbing it, and you have followed the protocol that I have explained to you. So we have Lakshmi Mishra says, can a nerve in a tooth repair itself? Well, if it's a young permanent tooth, many a times the apexes are not open. So let me explain you this. Each tooth has a root, and the roots are usually formed after the tooth comes out in the oral cavity. उसके 3 साल के बाद the roots are formed. तब तक roots form नहीं होते हैं. तो जब तक रूट्स नहीं फॉर्म हुए तब तक टूथ का टिश्यू रिपेयर का मैकेनिज्म जो होता है बहुत स्ट्रांग होता है. But it does not mean that you neglect the treatment. Treatment is mandatory and you have to rush to your nearest dentist. Okay. Um, अनिल कोहली says teeth space maintainer के बारे में कुछ जानकारी चाहिए. Well, Mr. Kohli, with this, I assure you my next topic would be on teeth space maintainer. But to brief you in short, these space maintainers are nothing but they are small clips which are designed to keep the teeth in place if any tooth is prematurely lost or removed. Now, let's say, for example, if this tooth we have removed or extracted or it is lost, how are we going to maintain it so that the teeth don't drift from one place to another until the another permanent teeth have come out? Is we give the space maintainers, and the function of the space maintainers is to maintain the space that is lost by premature loss of primary or milk teeth. And I'll take up this topic in the next session. Thank you for this query. Okay, I have an off-track question from Miss Kapoor, Mrs. Kapoor. She says that how do I take care of my kids' teeth? In brief, let me brief you. All you're supposed to do is brush your child's teeth twice a day, 3 minutes in the morning and 5 minutes in the night, with a soft bristle toothbrush and a fluoridated toothpaste. If your child is below 2 years of age, there are a variety of non-fluoridated toothpaste available in the market. But if your child is more than 2 years of age, fluoride toothpaste are essential and they are good for your teeth. Never use medium or hard bristle toothbrushes. Always use ultra soft and soft because you're going to clean the human tissues and not utensils. Avoid snacking in between meals, gargling after every feed, and that's how you take care of your teeth. And most important, visit your pediatric dentist at least once a year. Mandatorily, how you visit your pediatrician for annual growth and development assessment. The same way you should be visiting a pediatric dentist for annual maintenance of the teeth. Um, Sheetal has a query: is my baby is 9 months old and 6 teeth have started erupting. Can I start brushing? Of course, yes, you are supposed to, and you should start brushing as soon as possible. You can use a toothpaste, but a non-fluoridated toothpaste until your child is 2 years of age. Yeah, so we have, oh, okay. So another query is, okay. Mrs. Khan is asking that, my 4-year-old baby has fallen down a week back and my dentist has asked me to keep the tooth under observation. Yes, well, depending upon the condition, your dentist would have recommended to keep the tooth under observation. If the tooth has just popped inside the gums by 2 millimeters, it will come out on its own. And if he's definitely advised you to keep under observation, I don't think you really have to worry about it. Okay. Um, Okay. Raja Mani has a query that he had heard about teeth once they come out and it can be placed in the teeth. Can it be done in adults? Yes, this can be done in adults. So once the tooth has fallen down, and whether it's a kid's permanent tooth or an adult's permanent tooth, even in case if it's an adult's permanent tooth, the only thing is in case of adults, the tooth in the similar fashion take the adult and the tooth to the nearest dentist is going to fix it, splint it, and everything is going to remain the same. An additional procedure that may cost in case of an adult would be essential root canal procedure. Yeah. So we have one last query from Kavita Sahani. She says, how does a dentist check for nerve damage? It's an excellent query. Yeah. So, well, nerve damage can be assessed based on heat test and cold test. So after the trauma, again, when I said that certain tests, including radiographs, are taken, one of the tests that your dentist usually performs is he does a heat test. And what do they do in heat test is they have a specific instrument wherein they touch on the, after splinting the tooth and after stabilizing it, over periodical recalls. That is, we may call you after a week, after 3 weeks, after 3 months, after 6 months, and after a year, and they keep on following it up with X-rays, and they keep on checking the vitality of the tooth. And vitality of the tooth is nothing but they assess the tooth depending upon the heat vitality, या तो फिर heat करते हैं या cold करते हैं, and they place the instrument just on the top of the tooth, and then they assess. When the patient says yes, he's feeling sensitivity, that means that the tooth is alive and the nerve tissue is not damaged. And if there is no sensation at all happening to it, it means that the tooth is traumatized and dead. Even though the tooth is dead, and if the body has taken up and there is no movement, the tooth can be saved for life by just doing a simple root canal and a simple filling for that tooth. Yeah, so with this, we have taken all essential questions. I'll just go through ones if there's any which I have missed. So, okay, so one last query is from Aarti. She's asking that can the query from Aarti is, just missed it, just a minute. Yeah. So Aarti says that what after splinting and after doing everything, if the tooth is still mobile? Well, it really very rarely it happens that the tooth is still mobile. But if it is mobile, then obviously your dentist would have assessed based on the initial investigation of X-ray. If there is no bone fracture or any other involvement, then I don't think anything that you have to really worry about it. Yeah. So with this, let me brief you on today's session. That in a nutshell, given the pandemic times, it gets difficult for you to access and take the child in and out of any hospital or clinic. But trust me, visiting a dental clinic or a hospital is very safe because of all the protocols that are followed up at all dental clinics across the world. And if any kind of trauma still happens, you follow the same protocols, rush to the nearest dentist, never give up on time. Given the pandemic times, you're going to mess up big time. Instead, rush to your nearest dentist, and he or she may take the best care of it. So uh, yeah, so in a nutshell, I would advise you brush twice a day, take good care of your teeth, eat healthy. And I, Dr. Vivek Jogani, pediatric and preventive dentist from Mumbai, in association with BabyChakra. You can follow me by logging in with the code VIVEK on BabyChakra, and many more talks will come on the same. And if you want, you can also write to me on DRVIVEKJOGANI, Dr. Vivek Jogani at yahoo.com, or WhatsApp on 9967401415. I repeat, only WhatsApp 9967401415. So with this, I say that today's topic, it was a healthy discussion with you guys, good messages, good questions, and I have tried my best to share the best of the home care measures and the office care measures for if the young permanent tooth falls out, and what are you supposed to do as a parent. The only mantra is do not panic. So with this, I thank you for your time and patience. Thank you so much.